Hearing loss can be devastating and make you feel isolated and detached from the world. Dr. Jack Shohet of Hoag Memorial Hospital Presbyterian in Newport Beach explains what can cause hearing loss and what can be done to help you hear again.
Most people with a hearing loss don't think they have a hearing loss. It's more that others around them notice that they have a hearing loss and prompt them to come in for evaluation. But probably the most common thing is that people will say that they have an inability to hear very well in background noise environments when they go to a restaurant, or if they're in a crowded conference room and people are talking around them. They have a hard time hearing. Other symptoms that are associated with hearing loss is tinnitus. Tinnitus is a noise perceived in the head or in the ears, and it's a very common symptom associated with hearing loss. There's several different implants that are on the market right now, and there have been recently or previously available to patients with hearing loss, depending on the type of hearing loss that they have. Probably the most commonly cited in our popular TV and literature would be the cochlear implant. Cochlear implants are hearing devices, electronic hearing devices, for people that are completely deaf in both ears. And we've been doing this now for over 20 years, implanting children and adults with cochlear implants very successfully. There are other types of hearing devices for conductive hearing loss. There's a device called the BAHA, which will amplify sound through bone. It will use the body's conductivity of sound through bone to help aid people that have chronic ear infections, that are born without an ear canal, and have a significant conductive type hearing loss. It's also used to help people that have deafness in one ear, and it allows sound to go from the bad ear over to the good ear. And it's recently been very popular in that type of application. Coming up are the implantable middle ear devices. Those previous devices I was telling you about, those have a pretty limited application. But within hopefully the next year or so, we should start seeing a new wave of implantable middle ear devices. These will be for people who have hearing loss that would normally be aided by hearing aids. And I should point out that hearing aids are still the gold standard and will be the gold standard for hearing loss. But these implantable middle ear devices will allow people with chronic ear infections, with who like to be able to hear while they're exercising, and they can't really do that with a hearing aid. Those types of people will be able to benefit from a device implanted in their ear. We just completed an FDA trial on a totally implanted hearing device. It is surgically implanted through an incision behind the ear. And we are able to take an electronic transducer from a processor implanted underneath the skin and mount that transducer onto the hearing bones to allow people to hear sound directly. If you think you have a hearing loss, or if you think a loved one has a hearing loss, you'd be well advised to see your physician, have their hearing tested by an audiologist, and their ears and hearing evaluated.